Migori, Mombasa, Machakos, Tharaka Nithi, Vihiga and Mandera counties have been paid the allowances or promised payment as agreed in the 2017 return to work formula.
Kisumu is going on strike, is on pilot program. Nyeri is going on strike, is on pilot program. Isiolo will be going very soon. And yet the minister in charge of that universal health coverage has said nothing. It's as if nothing is happening. We can't have a minister like that. If the president wants to know the ministers who are not working and he wants to send them packing, the cabinet secretary for health is one of them who should leave. Funny games on why he's playing, we are not going to accept. He must know that he's in charge of lives of poor Kenyans. He should stop bringing politics. Na yeye akitaka tuambie ulimwengu ni kwa nini anapika wauguzi, tunajua ni kwa nini, lakini hata faulu. Chaglin Mogeni should leave because a government official cannot tell a trade union to issue a strike notice. Mkomo upo, hakuna kurudi nyuma, na wakitaka mazungumzo, Ministry of Labor appoint wenyewe waende kwa kila county wafanya mazungumzo na members. Mimi nimepeana powers ya kunegotiate kwa members. Hakuna negotiation itafanywa Nairobi unless inafanywa baina ya Wizara ya Afya na branch ya national government.
Now in Voi, the nurses' strike kicked off at midnight with officials of the nurses' union calling on residents to withdraw their patients from public hospitals and seek alternative services from private health facility providers.
Solidarity forever, for the union makes us strong. Hatutakuwa tunaomba tuhudumie wagonjwa wa kulazwa. Kwa hivyo tunaomba hivi, tafadhali ukiwa na mgonjwa pale Moi Hospital ama katika hospitali zetu za kulaza wagonjwa, tunaomba radhi kwamba tunakuomba utoe mgonjwa wako pale hadi tutakaposikizana. Hadi tutakaporudi kazini. Itakuwa ni makosa kumwacha mgonjwa pale. Tafadhali mchukue mgonjwa ukampeleka katika hospitali yoyote ambayo iko hapa katika county ambayo anaweza kupata huduma. Kwa hivyo hiyo ndio ombi langu katika wananchi wa Taita Taveta kwamba tafadhali mgomo hadi tutakapolipwa, hadi yule mtu wa mwisho atakapolipwa ile pesa zake, ndio tutakaporudi kazini.
Kumekuwa na hizi transfers ambazo hazieleweki. Kila uchao watu wanapewa uhamisho kwenda sehemu hii mara kurudi sehemu hii. Hiyo ili destabilize, ilifanya kazi haifanyiki. Kwa sababu umekaa hapa umepanga mikakati yako ya kufanya kazi, kesho unajikuta uko kwenye uhamisho, unapelekwa sehemu ambayo hujajipanga kuwa. Hujakaa vizuri, baada ya wiki mbili, miezi miwili tena umerudishwa kwingine. Sasa hilo limedestabilize. Mbali na hivyo, kumekuwa na upungufu wa vyombo vya kufanyia kazi. Madawa hakuna, tools hakuna.
Hata tukimaliza huu, wajue kuna notice nyingine inawafuata, maana kuna interviews zimefanywa na mpaka sasa hakuna barua wala matokeo yamefikia wauguzi wamefanya hizo interviews kuambiwa kwamba kupanda daraja kwao kutakuwa mwaka gani. Kwa hivyo tunawachukua muda huu bado kuwapatia ilani kwamba wakichelewa na hili wajue kwamba kuna notice inakuja tena. So ni muda wa kutosha kwao, wakimbie mbio, wamalizane na mambo hayo, barua za promotion zitoke haraka iwezekanavyo na wauguzi waendelee kulipwa kwa kubadilishiwa daraja zao kulingana na vile muda wamengojea, maana muda umepita mrefu sana.
Right, there you have it. Nurses in Migori, in Taita Taveta county have already started their strike. And let's have a look at what the Vice Chair of the Parliamentary Health Committee, Dr. Sharap Mishra, who expressed regret over the strike, saying many Kenyans are bound to suffer over a matter which would have been amicably resolved. Elvis Kosgei caught up with him this morning in Keses constituency. Let's have a listen to what he had to say.
Thank you very much, Brenda. Of course, we are coming to you from Keses constituency, where I'll be engaging Keses Member of Parliament, Swarup Mishla, who also doubles up as the Deputy Chairperson of the Health Committee in Parliament. Mheshimiwa, today the nurses had promised that they are going to strike as of yesterday midnight, and in North region you already have 3 counties, that is Elgeyo Marakwet, Trans Nzoia and West Pokot. Maybe as the Deputy Chairperson of the Health Committee in Parliament, what's your take on this?
First of all, I seriously condemn this strike. It's very untimely because we are going through a very serious crisis of economical management in our country. Our leadership, our president, our deputy president, everybody is trying their best to contain the situation. At that time, we should not come up for a uniform for a strike and leave the tools. It is not that prioritized. We should look for the priority. Well, okay. If we compare with other countries, African countries and our Kenya, we are well ahead as far as remunerations are concerned for the nurses and our other health workers. Now, I understand that graduate and engineer getting less than 1 nurse. So we don't want to go and every 6 months or 5 months we just threaten that we go for strike. Now, this strike will effect with a lot of high mortality and morbidity, and who will suffer? The universal health coverage, the way President wants to be, these countries should be effective. Now, look at the amount of money we are paying for the NHIF, for the whole free health service, the infrastructure, the equipments, the personnel, the health education. So now we should think everything in together and we go slowly. But now I request all the my colleagues, nurses, please revisit your decision about the strike, and we can always have a dialogue, and one day we will have a good time to have our money. And having said that, in future we should also have the government of Kenya, the government and the health ministry, and also Parliament should have a strong measures how to prevent the strikes. Even we can move a motion in the Parliament and declare it as an essential service in the country, so that we cannot go for strike. Army cannot go strike, police, if everybody goes strike, then this is our country. We should understand, nobody is against anybody. But thing is that we should be slow, and we should be considerate, and we should be timely. Having said that, when the government is recruiting the nurses or the health personnel, we should have strong terms and conditions about the strike. That is my comment. Okay.
Mheshimiwa, now according to Seth Panyako, who is the Secretary General of Kenya National Union of Nurses, is that the government, the 2 level of government failed to honor the return to work formula that was not fully implemented. Maybe as a member of committee in Parliament, what are you doing to ensure that there's also a favorable condition to these nurses?
Well, as member of Parliament, always our support with the health personnel in the ministry, all of them without any bias. We always support our nurses, all the health personnel and medics and paramedics. But having said that, we have to be also consider when in the family we are children, we cannot get everything from the father the same day. So my request to the union, my request to all executives of the union, please kindly, we have to take a softer path how to achieve our objective, not be radical. That is my request to all of them. Yes.
Using Uasin Gishu as a case study, maybe what are some of the measures that should be taken for the government to avert this in the near future?
Now, Uasin Gishu is a upcoming, particularly Eldoret and Uasin Gishu County is upcoming destination of medical tourism and travels for the whole country, domestically and nationally, regionally, internationally. Now, having said that, both public and private sector, we are doing tremendous great job. As we know that Eldoret is known, Uasin Gishu is known as the best weather, best athletes, best agriculture, now best medicine with best leadership. Now, with having said that, we are achieving 80 to 85% of medical practice, high-end medicine. So very soon we will have 100% with cancer care and heart. We are doing transplant surgery. We are kidney transplant. We are going to liver transplant. We are doing both replacement reconstruction surgery for orthopedics joints. We are doing all endoscopy, high-end neurosurgery, high-end spine, non-invasive pain management, everything we are doing, and in vitro fertilization. So this is one of the upcoming destination for medical tourism and travels for East and Central Africa, for 500 million people, 27 countries. So how to prevent strike, of course, we should make conducive work environment for our colleagues, for our health personnel. That is number one. Number two, we should pay them, but we have to have a dialogue and counseling. Once they understand, nobody will go to strike. And if they go to strike, then they are not for their demands, they are for other agendas. So we don't want to, please kindly my request, this is an essential service. People are in ICU, people are in theater, they need emergency, accident emergency unit, they need surgical intervention, they need cardiac and neuro intervention. So we should not go for essential, at least for critical care, the strike should not be prevailing. Yes.
Lastly, you've been traveling to the developed countries and now comparing Kenya to other countries. Maybe what are some of the measures that should be taken, maybe to also avert this in the near future, because we need a permanent solution?
Well, you see, solution, Kenya is a developing country. Kenya, we are where we are, and now where we are amazing. So we cannot wake up today that we say, no, it should be France and Spain, or it should be Germany. No, it cannot happen. It takes time. Let us work today, at least our children. Tomorrow will be the same situation what we are dreaming. But having said that, no country in the public sector, in the government sector in Africa has the amount of infrastructure, amount of high-end equipments, both diagnostic and therapeutic, I challenge. So we thank God and our leadership and government that the tireless work they are doing, and also Parliament. So I request our medics and paramedics, look, every county has now MRI, every county has CT scan, every county has dialysis, ICU, theater solutions. So we should thank God and our leadership that we are working. And imagine, don't forget that only a uniform will help you for your professional development. These equipments which government is investing also helping your professional development. So thank you very much to this conversation. But I request my colleagues to understand and take it as a holistic and wholly package, not as uniform. And then I jump to the strike. No.
Now, lastly, now that the universal healthcare will be affected, do you think that the healthcare should be devolved as it is right now?
The healthcare should be devolved the way it is, but we cannot now argue that. That is another forum. We require whether to devolve or not. That we need both central government, county government and parliament and everybody, and public participation is required. And also we compare the notes before the development and now how the health is doing. But I don't think that should be a big issue for implementing universal health coverage. But to achieve the universal health coverage, we have to be determined. We have to be very professional. We should be having more health professionals and trained health professionals. Health education should be in paramount and the priority. And then having said that, maintenance of the procurement and maintenance of the high-end machines should be very carefully monitored. And also infrastructure, which we have to also maintain them. And also wise dispensation and utilization of the resources is very important. Yes.
Thank you very much. That was Swarup Mishra, the Member of Parliament of Keses constituency, who's also the Deputy Chairperson of Health Committee in Parliament. But of course, it's a small matter of time that will determine the fate of nurses and also patients across the North region. Back to you in studio.
Thank you so much, Elvis Kosgei, for that report. Now,